Hello friends. In this video, I'm going to discuss about the Alzheimer's disease morphology, both gross and histopathological. So grossly, you are going to get cortical atrophy. You will get cortical atrophy. And cortical atrophy usually involves the frontal lobe, temporal lobe, and parietal lobe. And usually they spare the occipital lobe. And among these three, it is the medial temporal lobe, which is the first to be affected. You can appreciate the gyral thinning, and sulcal widening. Because of the cortical atrophy, there will be gyral thinning and sulcal widening. You can find a type of hydrocephalus that is known as hydrocephalus ex vacuo. Basically, it's a hydrocephalus mimic because here the ventricles are secondarily dilated because of the cortical atrophy. Okay, so ventricles are dilated, but it is not because of increased CSF. It is because the surrounding cortex are atrophied. Okay, so surrounding cortices are atrophied. That's why there is a compensatory dilatation of the ventricles that is known as hydrocephalus ex vacuo. Now coming to histopathology, I have told you there are two important points you have to remember. The first one is the neuritic plaques. So these are basically the neuritic plaques, and in the center you can appreciate there is amyloid core, and in the periphery you can appreciate there are neurites. Okay, so the neurites will contain the hyperphosphorylated tau. Okay, so in the center you will get the amyloid plaque, which will contain the A beta 40 and A beta 42. This is the amyloid core, and outside that you will get the dystrophic neurites, and these neurites will contain the tau, hyperphosphorylated tau. Because this is a neuritic plaque, and you will also get neurofibrillary tangles. Remember, this neuritic plaques, these are extracellular. Okay, these are extracellular. All amyloids are extracellular, so neuritic plaques are extracellular. But neurofibrillary tangles, these are tau containing, hyperphosphorylated tau containing filaments. These are tau containing filaments inside the neuron. These are inside the neuron. Okay, tau containing filaments inside the neuron. That means these are intracellular. These are known as neurofibrillary tangles, as you can see here. So this is the neurofibrillary tangle. So in the H&E stain, these are eosinophilic. These are better seen in silver stain like Belchowski stain, and these will look like these flame-shaped black color structures. Okay, these are flame-shaped black color structures in silver stain. Okay, now there are two more points you have to remember. In the blood vessels, you are going to get this amyloid angiopathy. So this is known as cerebral amyloid angiopathy. So in the blood vessels, you will get the deposition of this. You are going to get a deposition of amyloid. So that is known as amyloid angiopathy. And this cerebral amyloid angiopathy can cause intracerebral hemorrhage, especially lobar hemorrhage. One more point you have to remember that cerebral amyloid angiopathy can be seen in patients without Alzheimer's disease. So it can be seen in patients with Alzheimer's disease and also in patients without Alzheimer's disease. So it is not specific for Alzheimer's disease. And the last point is Hirano bodies. So sometimes you may get Hirano bodies. Hirano bodies are these are refractile. These are refractile, rod-shaped, refractile, rod-shaped, crystalline inclusions. Especially these are found in CA1 neurons of hippocampus. So these are Hirano bodies. As you can see here, these are rod-shaped, refractile, crystalline inclusions, especially found in CA1 neurons of hippocampus. Again, Hirano bodies are not specific for Alzheimer's disease. It can be seen in other neurodegenerative conditions. So among all these 4 points, only the neuritic plaques, these are somewhat specific for Alzheimer's disease, and the rest others are not specific for Alzheimer's disease. So that's all about Alzheimer's disease.